Good afternoon, everyone. I'm Ethel Massing, the Director of Innovation and Strategic Enterprises for Parkview Health. I'm thrilled to welcome you to this year's Healthy Care, Healthy Costs Innovation Competition, hosted by Parkview in collaboration with Highland and Butler University. This initiative is more than a competition. It's a call to action to rethink how we deliver care, reduce avoidable costs, and improve health outcomes for our communities. This year marks the fifth installment of Parkview's Innovation Challenges. Since its inception, this competition has been a global platform for healthcare innovation. Previous challenges have tackled pressing issues such as maternal mental health, pediatric chronic disease, and community health disparities. Over the years, Parkview has received more than 186 submissions from 29 states and 19 countries, showcasing a wide range of solutions from digital health platforms to novel health delivery models. The competition began as a response to Indiana's persistent health challenges, including high rates of chronic disease and limited access to care in rural areas. Each year, the challenge has grown in scope and impact, attracting innovators who are passionate about transforming healthcare through scalable, sustainable solutions. We tackle these challenges in three parts. First, in a data challenge where we gain insights into the problem using Indiana-specific data sets, which are then used to create our challenge statements. Next, we host the innovation competition, which you're watching today. From here, we'll choose finalists who participate in an accelerator. Then in November, we'll host an in-person showcase where you can come to Butler and learn even more about our finalists. Indiana continues to face significant health challenges, ranking among the 10 least healthy states in the nation. High rates of chronic disease, health disparities, and preventable hospitalizations demand bold, scalable solutions. That's why we launched this global challenge, to invite innovators from around the world to bring forward-thinking ideas, breakthrough technologies, and transformative services that can make a real difference. In March 2025, Parkview, Highland, and Butler University launched the Total Cost of Care Data Challenge, an initiative that brought together 10 student teams to analyze Medicaid patient data provided by the Indiana Family and Social Services Administration. Their mission was to uncover the root causes of high healthcare spending in Indiana, one of the least healthy states in the nation. The students identified key cost drivers such as chronic diseases, behavioral risk factors, and disparities in rural versus urban healthcare access. Among the most compelling insights, senior falls affect over 30% of Indiana's older Hoosiers annually, making them a leading cause of injury and cost. Physical inactivity continues to plague our seniors and fueling chronic conditions like diabetes and cardiovascular disease. Fall risk assessments, if we implemented them for just half of our Indiana seniors, we could save $115 million and prevent 41 deaths per year. So again, from those 10 teams with Butler, we had the winners from our data competition, and we're happy that Shams Parkar, who was on the winning team, actually decided to join the innovation competition, and he's one of the semifinalists that you'll see today. So we took the insights that the students presented during the data challenge to develop this innovation competition statement. How might we reduce preventable healthcare costs and improve outcomes for high-risk populations, particularly aging adults and those with chronic conditions through scalable, sustainable innovations? We are so blessed this year to have Butler and Highland join us in the competition. So now we're going to have representatives from each organization tell you a little bit about their company and why they decided to join us in this endeavor. First up is Nick Smarelli, the Director of Butler Entrepreneurship.
Thanks, Ethel. I appreciate the opportunity to work together on this initiative, and it's incredibly inspiring what I had the chance to hear today. One of my favorite parts about the fact that we did this together, because it really represents, I think, the ethos of Butler University. Everything that we're trying to do is in the pursuit of kind of innovative ways to provide higher education to students and then also impact the communities that we serve. So this was an opportunity that was a natural extension of that mission. For us, it was a chance to help solve a major problem affecting our communities. It was a chance to partner with two incredible organizations. And it was a chance to open up, I would say, the aperture of our students, both on the data side of things and on the innovation side of things, to solve for real problems and to remind ourselves that entrepreneurship is an opportunity not only to make money and grow a successful business, but to solve a real world problem. And so this was obviously a natural extension of us as a university. So we're incredibly proud to be a part of it. We're excited to help be a active part of the accelerator program as well, and continue this legacy around innovation and transformation and entrepreneurship that we're supporting for the state of Indiana, and then wherever our students may go. So thank you for having us as part of this group.
Now we'll hear from Shannon Orr, the Chief Operating Officer of Emerging Markets for Hylant.
Thanks, Ethel. For those who may not be familiar with our organization, Hylant is a fourth generation family-owned insurance and risk advisory firm with deep roots not only in Indiana, but also growing across the Midwest, the US, and internationally. We do work with thousands of employers across diverse industries, and we see firsthand the growing pressure companies face to manage rising healthcare costs while still providing quality benefits and care to their employees. And that's why we're here today. Innovation in healthcare isn't optional, it's essential, not just in insurance, but in how we approach the entire ecosystem of care, cost, and outcomes. The cost of care challenge aligns with our mission to be proactive partners in improving outcomes, reducing cost, and supporting healthier communities. Ethel, if you want to go to the next. At Hylant, our is simple. It's to help companies and individuals be the best at what they do. We bring together people, processes, and resources to really illuminate what matters and what might get in the way of accomplishing big things. So we do ask questions like, do you know why you buy insurance the way you do? And we help answer that by aligning a risk management strategy through a strategic framework of identifying, analyzing, financing, controlling, and then measuring. And this approach produces results and creates real value for our clients. If you want to go to the next slide, our footprint at Hylant is broad and growing. We have over 1,000 associates supporting clients from 21 offices remotely across the country and around the world. And this reach allows us to bring both a national insight with a local relevance. And last slide, just quickly, we're very proud of our culture and recognition. Hylant has been named one of the best places to work in insurance by Business Insurance for 16 consecutive years. We've ranked #1 best place to work in Indiana by Best Company Groups. And just on behalf of Hylant, we're so excited to be part of this challenge to elevate bold ideas that can truly move the dial for employers, employees, and the communities where we live and work. And we thank each of you for being here today.
Thanks, Shannon and Nick. Again, we are just so blessed to have you, both Hylant and Butler, as partners in this challenge. So again, I'm representing Parkview Health. We are the second largest health system here in Indiana. We currently have 15 hospitals, but we are rapidly growing. If you watch the news lately, we just announced 2 new facilities, one in Lebanon and one in West Lafayette. We are our region's largest employer with over 17,500 coworkers. We have over 1,200 employed physicians and 300 practice locations. We service a population of about 1.36 million people and have over 4 million encounters within our population each year. So while we have a primary service area of 22 counties, we really are expanding statewide and are excited to serve the people of Indiana. Parkview prides itself on being one of the best hospitals in safety, quality, service, and stewardship, and our awards speak to the commitment to that. So why did we join this competition? Decreasing healthcare costs is a really important issue for Parkview Health, which committed in 2020 to a $1 billion in rate reductions over 5 years, which we've accomplished. As the largest employer in Northeast Indiana and a state leader in quality and patient satisfaction, we view the partnership with Butler and Highland as a natural extension of our commitment to further measures that support cost reduction. Our innovation team hosting this challenge works out of the Parkview Miro Center, who's a leader in research and innovation. And at the Miro Center, we provide a wide range of services to drive innovation, including access to research and simulation, data, clinical pilots. So we are really excited to work with the finalists during the accelerator this year. Now for the competition. Since launching in May, we've received an incredible range of submissions. So today, 8 semifinalist teams pitched their solutions to an expert panel of healthcare leaders, investors, and innovators. These teams represent the cutting edge of health innovation. From AI-powered diagnostics and mobile physical therapy clinics to wearable blood chemistry sensors and cognitive health screening tools. So what's at stake? One team will be awarded a $10,000 cash prize and gain high-level visibility with health system executives, investors, and potential partners. But the journey doesn't end there. Up to 5 teams will be invited to join our 2-month virtual accelerator program, where they will work closely with mentors from Parkview, Highland, and Butler University to refine and pilot their solutions. Finalists will convene on November 20th here at Butler for an in-person showcase, which you're all invited to join, and Nick will talk a little bit more about it again at the end. Today, we were joined by an esteemed panel of judges. They are healthcare industry leaders and economic advisors from representative here of Indiana. So you can see Ting Guti from the Indiana Economic Development Commission, Vince Wong from BioCrossroads, Nick Smurley and I were also on the judging panel. We had Ryan Locke from the IEDC and Dan Hylett from Highland. And then we also were joined by some Butler student judges today, so we were really happy that they could join us and see the pitches and give their feedback as well. So without further ado, we will have pitches by our top 8 semifinalists. And just a reminder to them, they will have 3 minutes to pitch to you all. Our first team, NeuroChat, was actually, they had a family emergency and couldn't join us for this afternoon's presentation, but I'm going to tell you just very quickly about their solution, and I apologize, I don't have their pitch memorized, so I will have to read it for you. NeuroChat is a diagnostic tool that uses artificial intelligence to screen for neurodegenerative diseases through a simple, accessible interface powered by language-based assessments. The platform asks users a series of spoken yes or no open-ended symptom inputs that are analyzed to detect early signs of neurodegenerative diseases. NeuroChat is committed to expanding early detection and access to neurological care, particularly for underserved populations. The process takes less than 10 minutes and can be used by anyone with internet access. Clinicians and caregivers can view results instantly, helping prioritize follow-up care. By removing cost and complexity, NeuroChat empowers users to take the first step towards diagnosis without fear or delay. Next up, we have Andrew Cothrell from Kalele Health.
Hello, I'm Andy Cothrell, CEO and co-founder of Kalele Health. Kalele is reshaping chronic disease management with a new wearable sensor. For too many chronic disease patients today, a health crisis is their trigger for getting care. That's one reason why outcomes are so poor and costs are so high, consuming 85% of US healthcare spend. I'm sorry, my tech just gave out on me. So the sensor is a painless sensor. It's worn for 2 weeks at a time. It sits on the arm and lasts for 2 weeks. For some of you, it might look familiar. It mimics the form factor and materials used by diabetics to monitor blood glucose levels. Our measurement technology is different, 41 pending patents worth of different, but we mimic the look and feel of glucose monitors. The key to the technology is a measurement method using something called an aptamer, which is just a finely tuned strand of DNA. Because we were the first to figure out the technology, we're positioned to dominate the field. Dr. Heikenfeld at University of Cincinnati and I co-founded the company. We've got lessons learned from 20 years of industry experience at Abbott and Roche and running prior medtech startups. Some that exited, some that didn't. We're applying these lessons to nail it before we scale it with Kilele's sensor, strategically entering the market in a condition called pediatric phenylketonuria, or PKU. It's a pediatric orphan condition that's genetic, and it opens up a great first market for Kilele. We already have our path to FDA planned. Once we nail PKU, we have some giant applications queued up in heart failure, in insulin-dependent diabetes, and for patients who suffer from more than one chronic condition called multimorbidity. These markets combined exceed $45 billion, and that's just the US market. In April, we were the first in the world to report 10 days of aptamer biosensor life in an animal model. We're now full steam ahead for our first human study in the first quarter of 2026. With our early engagement with strategics and excellent prospects for a strong exit, and hopefully support from this program, we look forward to the generational opportunity we have in front of us to reshape chronic disease management. Thanks.
Thank you, Andrew. Next up, we have Alexis Karahalis from Septo. You're good, Alexis.
Imagine you are recovering from surgery and a small sore on your hip goes unnoticed until it becomes infected. Imagine you're a nurse juggling 15 patients and you simply don't have the time to check every pressure point every hour. Imagine you're caring for your father at home, worried you'll miss the early signs of a bed sore until it's too late. These scenarios aren't rare. They happen every single day. They're costly, painful, but most importantly, they're preventable. Skin and soft tissue infections account for millions of hospitalizations, and consequences like sepsis kill over 350,000 patients annually. Current monitoring methods like nurse checks, expensive monitors and sensors, and other invasive tests are unreliable, unaffordable, or simply inaccessible. What's missing is a way for anyone, a nurse, a caregiver, a family member, whoever it might be, someone where they can quickly recognize risk before wounds turn severe. That's why we created Septo, an ergonomic X-shaped bandage designed to wrap around pressure-prone areas like heels, hips, and elbows. Septo is actually powered by a plant-based color changing indicator. It provides a clear visual alert when infection risks rise, and it has this clear alert directly on the bandage, which changes color from a bright magenta to a deep violet purple by reacting with drainage and other exudates that come directly from these wounds. No wires, no Wi-Fi, and no guesswork. It's a simple signal that anyone can understand anywhere. Our first step is actually long-term care facilities, where bed sores are most common and lawsuits end up costing providers billions of dollars annually. From there, we plan to expand to hospitals, home healthcare networks, and even global markets where simplicity and affordability are vital, especially in rural and low-income communities where Septo provides a cost-effective and most importantly, a sustainable solution. The result: billions in healthcare and infection treatment are slashed. That's lower costs for facilities, fewer infections for patients, and most importantly, peace of mind for their families. We've been working closely with mentors and contacts through companies like Rush Hospitals, 3M, Avery Dennison, and more, while we're also patent pending. Septo makes prevention simple, affordable, and universal. As populations age, more elderly patients are left vulnerable to preventable infections and, most importantly, bed sores that we're looking at, making an affordable, visual solution like Septo critical for ensuring the safe and dignified care. Because preventing a wound should never just depend on luck, staffing levels, or expensive equipment. It should really just take advantage. So join us and say no to infection with Septo. Thank you.
Thank you, Alexis. Now we'll hear from Neil Jarrett of Bedside Bike.
Hey everyone, nice to meet you all, and thanks for being here. You've all heard the phrase movement is medicine. As much as our society promotes movement for health, our healthcare system is guilty of ignoring the other side of that inspiring statement, that immobility is harm. In hospitals today, patients spend over 90% of their time immobile in their hospital beds. And if you're over 65, that might mean losing muscle at a rate of 2% a day. It's no wonder that 1 in 3 patients over 70 leave the hospital more disabled than when they arrived, and that falls are 8 times more likely to happen in the hospital than outside of it. One of the myths that I often dispel as a physician is that patients in bed are too sick to move. But research has shown that 60% of bed rest orders are in place without a documented medical indication, driven largely by liability for falls when a patient leaves their bed. In addition, bed alarms, railings, IV lines, catheters, and flimsy backless gowns all send patients the same message: don't get up. This is really hard behavior to change. Falls are deadly and costly. Meanwhile, clinical trials have shown it takes just 400 to 900 steps a day for 20 minutes of cycling to prevent the harms of immobility in the hospital, reducing fall risk by up to 44% and getting patients home faster. Right now, nobody's even reliably tracking this data. It's a total black box. The bedside bike is the first solution designed to circumvent the barriers to mobility in the hospital by offering an in-bed, patient-operated mobility system that transforms hospital beds into mobility machines, turning that 90% of downtime into active recovery. We open the black box of mobility by tracking the data, delivering it directly to both patients and providers. By automating this data collection process, we release nurses from the mobility documentation burden and automatically record objective movement metrics that inform care. Our AI-powered personalized software offers predictive analytics that can both assess baseline risk and deliver targeted mobility plans to patients, catching in-hospital decline before it spirals. Hospitals can be really demoralizing places, so we're building a positive and engaging platform around one of the most important drivers of hospital outcomes: exercise. At Bedside Bike, we believe that mobility is medicine, and we're doing something about it. Join us because your mobility may one day depend on it.
Thank you. Next up, Alexandra Husted-Mai from APARC.
Hi, my name is Alex Husted-Mai, and I'm the research audiologist for Purdue's Accessible Precision Audiology Research Center. I'm with Dr. Mike Hines, who's our director, and APARC, as we call it, is working on reducing the burdens of untreated hearing loss. In America, there are 36 million adults with hearing loss, and it disproportionately affects those in rural areas, with 20% of adults living in a rural community having hearing loss compared to only about 10% in a metro area. And of these 36 million adults, only 20% of them seek help or treatment for their hearing loss, and on average, they're waiting 8 to 11 years to do so. This has serious consequences, as untreated hearing loss is associated with higher rates of depression, earlier onset cognitive decline, and a higher fall risk. This leads to lower wages, more inpatient stays, and higher healthcare costs. The reason it's hard to seek treatment for hearing loss is really twofold. The first is accessibility. There's only one audiologist per 24,500 people in the US, and in rural communities, that's even lower. The other issue is there's not diagnostic precision in our field currently. You would be diagnosed with a sensory neural hearing loss no matter what the underlying cause is. And this diagnosis then leads to a one-size-fits-all hearing aid fitting approach, which works for some, but not for others, and leads to people stopping pursuing their treatment. APARC is trying to address both of these issues. And on the accessibility side, we opened a second lab in the 16 Tech Innovation District of Indianapolis, which is in a low resource community and opens directly into a food court where we do things like community outreach events, farmers markets, anything to engage with the community, and are also there to provide free comprehensive hearing evaluations to community members where we keep the data, but as a licensed audiologist, I'm able to provide them custom results and recommendations when they come in. However, this only works if you are able to come into a lab in West Lafayette or Indianapolis. And we realized that for rural community members, we had to flip the hearing healthcare model and start bringing services to them. We are currently piloting a grant with the Delphi Family Health Clinic, where we use completely mobile equipment once a month and are able to provide the same quality hearing assessments in their community. But for those rural areas that don't even have a health clinic, we really think the next step is going to have to be telehealth. And so that way community health workers there could provide the services under the guide of a licensed audiologist virtually. And we'd like to do this with a bundled workforce hearing wellness program. On the precision diagnostic side, we're using mechanistic work being done on campus and combining it with all the data we've been able to gain through our community outreach to build an AI learning model that will be able to separate out these subtypes of sensory neural hearing loss. And once you can do that, you can personalize hearing aid fittings, and that right now and in the future, hopefully personalize pharmaceuticals and gene therapies. We have a really great team of scientists with us working on this project and are looking for some help on the business side to help us develop a sustained revenue model to make sure precision audiological care is accessible to everyone no matter where they live. Thank you.
Thank you. Next up is Fallguard, and we'll hear from Shams Parkar.
Hi everyone, my name is Shams Parkar, and today I want to talk to you about Fallguard. Fallguard is committed to reducing elderly fall risk through fall prevention interventions. We were interested initially in fall prevention from a data challenge that we had completed back in April, where we saw that falls were a leading cause of elderly injury deaths and had a high healthcare cost associated with it. For instance, in 2018 alone, elderly falls contributed to $1.1 billion in healthcare costs in Indiana alone. In addition, about 1 in 4 elderly individuals have fallen at least once in their lifetime, and an estimated 10 to 15% of them will end up at the emergency room. The good news is, falls can be preventable with appropriate clinical guidance. Unfortunately, we quickly realized that falls are not an easy issue to deal with, either through a lack of patient involvement with fall prevention interventions, or through a lack of discussions by the primary care provider about this problem. However, we want to make it easier to document fall risk and help elderly citizens stay engaged with fall prevention strategies. We currently have not launched our software, but we've added some features such as a recent fall log to help patients track any recent falls they've had, and a falls analytic page that can be exported for their primary care provider to see. It'll include things such as how many times they've exercised and what are their current treatment options in terms of reducing their fall risk. Going forward, we are focused on improving patient data confidentiality, improving what services we offer, especially exercise-based ones, which are the leading source for fall prevention, and getting more clinical input to improve our analytics. We hope to keep this project going forward, and I want to thank Butler, Highland, and Parkview for their help with all this. Thank you.
Thank you, Shams. And again, thanks for your contribution during the data challenge portion of this competition as
A
well.
pleasure.
Next up is Todd Bracken from RespirCare.
Good afternoon, everyone. I'm excited to introduce you to RespirCare's innovative Numinode patch. It's a first-of-a-kind AI-empowered wireless disposable medical device that integrates continuous clinical-grade auscultation along with core vital sign monitoring into a single bandage-sized wearable. Our patent-pending Numinode patch replaces an entire suite of traditional bedside devices by continuously capturing respiratory, cardiovascular, and gastrointestinal sounds, as well as heart rate, respiratory rate, blood oxygen saturation, core body temperature, and blood pressures. And that is without the need for a bulky blood pressure cuff. This all-in-one wireless device leverages AI-powered analytics, streamlines costly clinical workflows, and eliminates tangled wires and expensive equipment clutter, and empowers providers to deliver faster, safer, and more informed patient care, and all this both inside and outside the walls of the hospital. Our innovation reduces preventable healthcare costs while simultaneously improving patient care outcomes, especially for high-risk populations and those homebound managing chronic conditions. Behind the patch is a sophisticated array of embedded technologies, including advanced sound frequency transducers, advanced PPG sensors, and other microbiosensors. These signals are all locally processed and securely transmitted using wireless telemetry protocols compliant with the strictest of leading cybersecurity and healthcare interoperability standards. To ensure maximum value of the data we collect, RespirCare is building data integrations with mobile device platforms such as iOS and Android devices, hospital bedside monitoring systems from companies like Philips, GE Healthcare, and Baxter Welch Allen, electronic health record systems from companies like Epic and Cerner, as well as cloud-based remote patient monitoring platforms, including RespirCare's own Numinode Link RPM platform. Our initial focus is on hospital bedside care. However, the Numinode patch seamlessly extends across the entire continuum of care, from inpatient to post-discharge recovery to hospital at home and remote patient monitoring settings. We're also uniquely positioned to enhance military and first responder acute care, enabling real-time clinical-grade physiological monitoring on the battlefield, in field hospitals, at natural disaster locations, in ambulances, and other high acute mobile environments where bulky equipment is impractical or unavailable. As hospitals strive to reduce the length of stay while also improving care outcomes, and as the aging population drives demand for home-based care, continuous clinical-grade real-time monitoring outside the hospital is no longer optional, it is essential. RespirCare is redefining how and where clinical-grade continuous vital sign monitoring happens, from the bedside to the home to the battlefield. You're invited to partner with us. We're not just cutting cords, we're significantly reducing healthcare costs while simultaneously unlocking and expanding better patient care, patient safety, and clinical outcomes.
Thanks, Todd. And our last semifinalist today, Lola Amashure from Theramotive.
Thank you. Can you hear me?
Yes, we can.
All righty. In my sports medicine career, I traveled the country with elite athletes, providing them healthcare on demand. Wherever they were, so was I. Now just imagine if everyone had access to on-demand care. That's the future that I'm building. At Theramotive, we're building the future of physical therapy to restore what was lost for anyone, anywhere, at any time. 129 million people need physical therapy every year, but 70% of patients never go beyond their 4th visit. The truth is, traditional clinics are not convenient, accessible, or scalable. Instead, millions of people use the ER for primary care and contribute to a $314 billion healthcare crisis. Indiana, in particular, has a very high utilization rate of emergency room use and ranks 8 in the nation. But there is good news. Physical therapy is proven to reduce ER utilization by 15%. And Theramotive is building the future of physical therapy with clinics that adapt, evolve, and move to meet the needs of high-risk, high-cost communities. Our affiliate partners include American Heart Association, Mount Sinai Health System, and Northeastern University. Together, we create healthcare on-demand models, so our clinics are delivered wherever older adults live, work, and age. And our licensing model empowers physical therapists to scale Theramotive nationwide. Our pilot has yielded amazing results. After completing 500 visits, we are proud to boast a 96% retention rate, over $50,000 in revenue, and have saved $76,000 in costs for our enterprise health centers in less than 50 days. Now just imagine what Theramotive can do at scale across the nation. Over 10 years, we plan to franchise our mobile clinic model across the country to transform how physical therapy is accessed and delivered to millions. The future of physical therapy is here. Are you ready?
All right. I don't know how I won the award, but I had the chance to be lucky enough to be the one that gets to announce the winner of today's effort. And all I wanted, frankly speaking, was to be the one who gets to do the big giant check. And unfortunately, the virtual environment doesn't allow us for that. So so I will have to use my enthusiasm as a substitute for the big check. It was fun to be in the room. I think it was fun to be in the room because you had such incredible talent from Indiana weighing in on the absolute winner and a lot of different perspectives, tons of experience in order to kind of manifest what we ultimately decided was the $10,000 winner of the competition. So again, the moment you've all been waiting for is to figure out who that is, and I'm excited to announce that. Drum roll, please. Is Bedside Bike is the winner of the competition today. You can't hear it now, but the room is cheering for you. So if the team from Bedside Bike is around and available, I'd love for you to come off of mute and your video, and just this is your chance to say a few quick words to the group. So if a representative wants to hop on, that would be lovely.
Yeah, hey, I'm here. Thank you very much for not only hosting this super well organized competition, but for hearing us all out. And just seeing all the other folks that were giving their 3-minute pitches today, I was super impressed by what's happening in Indiana and around the nation. So we're incredibly honored to be presented with this award, and I'm super excited to co-develop with the Parkview Health ecosystem with Butler and with Highland moving forward.
Thank you, Neil. I appreciate that, and you are most definitely in good company. So congrats to you and congrats to the team. And so just a reminder, the winners of the companies that will be joining us on the accelerator will be announced tomorrow via email, and then a full public press release will be going out next week. But we've got a great accelerator program teed up. We've got resources from each one of our 3 respective companies, but then expanded out to other Indiana resources, both from funding and training to help augment the content to make sure it's a great event and a great accelerator and a great resource for businesses that are changing the future of healthcare in Indiana. So again, an honor and a privilege to be associated and to get to know all of you. And so on behalf of Butler, Highland, and Parkview, thank you very much for your time and effort. And I look very much forward to the opportunity to continue to see your journeys. So thank you all.
And I'm just going to pop in one more time. Sorry, Nick. To remind you to join us on November 20th for the live event. You can scan the QR code that's on the screen, and that will take you to the event sign up. So we're so thankful for you joining us today. We hope to see you in November. Thank you.